Okay, good afternoon. We're going to start our meeting. Welcome, everyone, to the Public Safety Coordinating Council for Jackson County. We'll go around and introduce ourselves. I'm Tina Qualls, the chair of the committee.
I'm Kiki Park-Rose. I'm the Jackson County Community Justice Director.
Josh Aldrich, I'm the jail commander.
Randy Sparacino, Mayor.
Justin Ivins, Police Chief, Member. Rick Bear, County Commissioner. Danny Jordan, County Administrator.
Doug Engel, with Public Defender's Office. And if I could, I'd like to introduce Clint Oborn. He's going to be taking my job in July, so he'll be at these meetings from then on.
Welcome.
Okay. I'm Jennifer Lind. I'm the CEO of Jackson Care Connect, and I want to share that we have a conference, a recovery conference coming up June 9th. I can't get my phone to work in here, or else I would have given you the right date. But maybe I can email out a little information about it, looking to get non-providers there, people who are really impacted by a lot of the substance use that we're seeing and feeling in our communities.
I'm Travis Christian, I'm Vice President of Direct Construction.
Good to see you.
I'm Jennifer Melanick, Director of CASA of Jackson and Josephine counties.
Thank you. And in the back chair, do you want to start?
Sir Hubbard, Deputy Director here at the Adult Probation.
Mike Parsons, City of Central Point City Council, Central Point Police Department. I am the coordinator of volunteers.
Jason Peterson, I'm the Emergency Manager for the Outlet City. Joe Ferguson, Deputy Director of the Dual Site.
Brittany Whitmire, Program Manager here at Adults.
Ryan Butler, Grants Contract Manager here.
Christina Patron, Program Manager with CASA.
Welcome. And on WebEx, who do we have? Do we have anyone on? Yes. Just Rita. Rita, do you want to introduce yourself?
Hi, Rita Sullivan. I'm a psychologist in town.
Amigo, next, my name is Hilda Montenegro Six, and I am the CEO of Celebrate Diversity.
Dr. Lee. Oh, go ahead, Chair.
Leaders for Basti, Southern Oregon University.
And Sheriff Sickler.
Me, Sickler Sheriff. Hey, no driving and talking. I pulled over.
Is that an online? Okay. Okay. So thank you. The next, we need to adopt the minutes from our March meeting. Did everyone have an opportunity to see those? Motion to pass the minutes.
Move to approve. Second.
Second.
All approving the minutes. All in favor?
Aye.
Anyone opposed?
It's Danny.
And Jennifer Lynn abstains. Okay, so those pass. Thank you. And do you want to tell this too?
I'm going to go with everything you said this morning.
Yes.
I'm going to do my best to be louder today. My name's Kiki Parker-Rose, and I'm the Jackson County Community Justice Director. Today I'm before this committee requesting approval to apply for the Justice Reinvestment Grant. I talked about the Justice Reinvestment Grant the last time we met, but again, for context, it's the Justice Reinvestment Program. Is set up to provide funding to counties to plan, implement, and expand initiatives that establish a process to assess individuals and provide a continuum of community-based sanctions, services, and programs designed to reduce recidivism and to reduce state prison bed usage. While at the same time protecting public safety and holding individuals accountable. The grant is in two separate formats this year. We put in our initial request for, notice that we're going to apply for the grant. And then after the legislature makes a decision on how much funds will be available in the grant, we'll submit our actual application where we outline what the funding would look like for our programs. So I'm asking for a letter of support from the Public Safety Coordinating Council, as well as a number of other folks that we'll be reaching out to support our grant notice of interest moving forward. And I'm happy to answer any questions.
You need a motion to approve that? It says vote required.
Yeah,
Yes.
If you could, I'm looking for a motion to approve a letter of support.
So moved.
Thank you.
Second.
Okay. All in favor?
Aye.
Any noes? Any abstain? Okay, so approved.
Thank you.
Thank you. So April is Child Abuse Awareness Month, and so we are having CASA and the Children's Advocacy Center provide presentations to our group, and we're going to start with the Children's Advocacy Center.
So I'm Tammy Pitson. I'm the Executive Director of the Children's Advocacy Center. I have been in that role for a little over 9 years. Prior to that, I was at another advocacy center in Colorado Springs, and I did child protection investigations for a period of my life when I was young. So the Children's Advocacy Center of Jackson County provides services to children 0 to 18 who have experienced abuse or witnessed violent crime. Is to meet the needs of children and families in a community by providing a community-based, child-focused center that facilitates a compassionate, multidisciplinary approach to the prevention, treatment, identification, investigation, and prosecution of child abuse. That's a lot. Really what we do is we work with a multidisciplinary team to provide a holistic, evidence-based, trauma-focused intervention into the response of when a child has been abused. We are accredited through the National Children's Alliance, and our organization is a grassroots organization started by a group of professionals and lay people in our community in 1987 under the leadership of Mark Huddleston. So this is just a little bit of a graph of our numbers for the last few years, and it's through March because that was the numbers that I had available. So prior to COVID, we were seeing almost 900 children a year. You can see that they dipped down in COVID, and we've not fully recovered. We're still seeing fewer children than what we had seen before the pandemic. But interestingly enough, we're providing those fewer children and families with more services than individual services than what we were. The scope of the problem of child abuse in Jackson County. So our victim rate is about 16 per 1,000. We are above the state average and we're above the national average. And those are statistics from the CDC and the Oregon Child Welfare Data Book. I'm probably not telling you guys anything that you don't already know. You see this a lot every day. And what ACEs, the Adverse Childhood Experience Study, tells us is that these kids without intervention do grow up and have more problems in life. They have more chronic health issues. They have more, they're more likely to commit violent crimes. They are likely to come into multiple interactions with the system. So really what we're trying to do is to mitigate as many of those impacts, that lifelong impacts that abuse has on children, so that they can live a productive life and be a healthy member in society, and really so that our community is a healthier place to live in. I'm going to skip through that. That's our leadership and our staff. What I will tell you is that we have on our staff and on our board, we have over 254 years of cumulative experience of working in children's advocacy centers with children with trauma and managing a nonprofit. We have the Jackson County Child Abuse Multidisciplinary Team. We are one member of that team. This team comes together to agree on protocols and ways that we will investigate and handle child abuse in this community. And our members are made up of local law enforcement, the DOE's office, ODHS, DOJ, CASA, Jackson County Mental Health, Medford School District, Public Health. We have 2 members from Community Justice and other nonprofits and organizations that intervene in child abuse in our community. So our core service programs, we provide forensic interviews utilizing the Oregon Interview Guidelines, which is in statute, and They are based on evidence, and so they're evidence-based and based on research. We also have a family support team that provides support and advocacy. We have a forensic medical team, or clinic, that provides evaluations, evidence collection, diagnosis, and treatment of child abuse. We're really excited because we're in our 4th year, we've expanded our medical response so that we have the ability to provide 24/7 acute coverage in the emergency departments for children who have experienced child sexual assault. Prior to that, we had a part-time medical director. We have a full-time medical director, a full-time nurse practitioner, and when we will be fully staffed, we will have 8 nurses that are trained to provide pediatric sexual assault evidence collection. At the hospitals, we're able to respond now to both Rogue Regional Medical Center and to Providence, and actually are expanding into Joe County to 3 Rivers. We also have 3 on-site therapists that provide therapy interventions for children. They do screenings, assessments, individual, group, and some family therapy. Equitable access is a value to us, and so therefore none of our families are charged any out-of-pocket expenses. We get a little bit of reimbursement from insurance for services with medical and with therapy. So,
Tammy, I have a question.
Yes.
It's Hilda on Zoom.
Yes.
On the prior slide where you had the members, the one even before this one, sorry. I see Medford School District, but none of the other schools in Jackson County, and I was just wondering why that is, or if there has been an outreach to the other school districts.
That's a good question. We are required to have a person on the MDT from a local school system. Most of the kids that we deal with are in Medford, and so that's where historically it has been. And so that's where we've had people from. If there were, and I will tell you, sometimes it's a little difficult to find someone that has the time to do that, but I would say if there were any school districts that were interested in being a part of the MDT, we would certainly want to talk with them.
Yeah, great. Thank you so much.
So forensic interviews conducted by specially trained professionals. Before 2018, we would have law enforcement officers trained as well. We have moved to a model that's in alignment with most of what's happening across the country, where we have dedicated interviewers in the CAC. This frees up a lot of time with law enforcement because there's a lot of training, a lot of continuing ed, and a lot of upkeep that goes into remaining competent to provide these interviews. I actually got ahead of myself. Oh, I'm going to go back. We have also, in the last 12 to 18 months, started doing hair strand testing on children who have been or have been suspected of being exposed to drugs. We've done probably, $15,000 worth of testing. That probably equates to 50 or 60 kids. Most of those are coming back positive. It shows a 3-month window, and they are generally coming back positive for more than one substance. So it's not coming back positive for like marijuana and only THC, but generally coming back with fentanyl, meth, amphetamines, cocaine, I think heroin. Not as much cocaine and heroin, more of the fentanyl, methamphetamines, and amphetamines.
Tammy, I have a question. We just had a fatality in Josephine County that we were on the fatality review for, and there doesn't seem to be any prosecution happening. It's a 2-year-old boy who died of a extreme fentanyl overdose in home with parents. And are you guys able to prosecute any of these cases?
I don't prosecute any
Well,
of these
not
cases.
you, but, you know,
I will say there are some challenges because you have to show, well, and in that case you would be able to show an impact on the child, but you have to show an impact on the child. We're all aware that possession is not criminal in nature at this point, and so I think this is one of the unintended consequences of that legislation, and I think people smarter than me are looking at that. I will tell you it's tough. We believe it's very expensive to do this program, but we believe that it's really important that those people who make the decisions around child safety have that information. So we started out because it is expensive. It's not something that we get reimbursed for. It comes out of our general operating budget. We were pretty stingy with it, and then we realized if there's an indication, there's an indication, and we just kind of pulled the trigger. If there's a medical indication or a report that shows that this needs to be done, then we're going to be doing it. Interestingly enough, we have to have caregivers' approval to get these tests. We've not had anybody deny the test to be completed. In our therapy department, I don't really know the answer to that question. I guess that's what I would tell you. We are seeing it a lot. We've seen infants here in Jackson County as well present to the hospital, white powder. That was kind of what was reported to the emergency department, and it did indeed turn out to be fentanyl. In therapy, we utilize evidence-based modalities to resolve trauma. Mostly we use trauma-focused cognitive behavioral therapy or trauma-focused cognitive behavioral therapy for children with problem sexual behaviors, which are children who are sexually reactive, that are sexually active with other children, but are under the age of really being able to charge. So most likely something has happened to them, they've seen something, they've been exposed to pornography and are now acting out in an inappropriate way. We have 3 therapists, and Fancy, our program assistance dog. Fancy has a full caseload, probably the highest caseload of anybody at the Advocacy Center. Our family support team provides therapy or provides support and advocacy services, works with families to identify barriers to engaging services and needs. For us, when families present to us, really the most important thing to us is that there is the suspicion that a child has been abused. For a family, that may or may not be the case. They may be worried about how they're going to sustain their housing. They may have food insecurities. They may just being at the CAC for an appointment might be a hardship for them, where they have to choose between gas to get to the CAC or buying milk. So we try to identify those barriers. We cannot remove all of them ourselves, and we reach out to our community partners to be able to do that. Community engagement is really just a new look at outreach and our trainings. We do child abuse prevention trainings. We do professional trainings. We put on a symposium. Before COVID, we put it on every year. We're going to try to reboot that this year. And our child sex abuse prevention program has trained over 2,000 adults in our community to respond to allegations of child sex abuse, and also manages our volunteer program. We are designated by the Department of Justice as a model for children's advocacy centers and MDTs across the state. So we provide services in the southern region to the 5 counties, Klamath Lake, Jackson, Josephine, and Curry County. What that really means is that our center and our MDT is providing expertise for technical assistance, for training, information and referral, and complex case consult to those MDTs and those counties. Our expertise and our regional staff, I'm an accreditation site reviewer for the National Children's Alliance, so I go around with other CACs and make sure that they are following our standards. We have the hair strand testing, which is not available in every county across the state. but in many counties. We have the pediatric singing program embedded in a children's advocacy center, which is the only one in the state. Victim advocacy, forensic interviewing, rural resourcing, and collaborative projects, child abuse prevention, carbon law training, training for teaming and MDT, and expert testimony in child abuse cases. So really what I want you to leave here knowing is that in our county, we really have one of the top in multidisciplinary teams. We are just one member of that team. CASA is a member of that team. But we have some experts that are going across the country and actually teaching other people how to do what we do in our community. And together, we are creating communities where children are safe and families are strong. I kind of buzzed through that because I wasn't sure where I was at on my time. But what I would say is I'm really, really proud. I've done this work in about 3 or 4 different states across the country. And what we have going on here in Jackson County is really fantastic. We do have a lot of social issues here that are at the higher rate than the national average. But we do have pathways out, and part of those pathways out is providing the interventions and the services early on when children are experiencing trauma. And it has to be consistent. We have to do it for a really long time, but I really think, like, probably not in my generation, maybe not my grandchild's generation, but in the generations to come, we will be able to mitigate what's happening with our homelessness issues, our substance abuse issues, and our crime rates in our community should all decrease as our children get healthier and healthier and healthier. I don't know if anybody has any questions or, yes?
I do. So going back to the hair strand testing, so you did about 50 children so far?
It's probably more than 50. 50 was the last time that I looked, and that was in the last probably 12 to 18 months.
Did they all present for exposure?
No. When we started, so some of them presented for exposure, but what started happening is as we were doing our medical evaluations for cases that got referred in, sometimes there's other things, and then as they start taking social histories or there's been an investigation, they get information from law enforcement, they get information from child protection, and there's an indication that hair strand testing needs to be done. I'm always surprised because sometimes most of the time we try not to have the person of concern to be the person to bring the child into the CAC, but we don't always know what all the concerns. So it's very interesting to me that we've not had anybody deny the hair strand testing, and it takes a look at a 3-month period. So as the roots, you have to have hair, as the roots grow out, sometimes that's hard in infants because they don't have a lot of hair, but as the roots grow out, you have to actually cut their hair, and it's not always a little bit of hair, they're kind of trying to get it under, but parents are signing to have it done, and at one point I could tell you that none of them came back negative. I think now we might have had one that came back negative, but most of them, if not 90% or higher, are coming back with multiple forms of substances. Yes?
The slide that you showed showing that Jackson's rate of abuse is double the national average and 150% of Oregon. Do you have any theories on why that is?
Statistics are one of those things that I'm not really sure that I can tell you for sure, but I think part of it, again, having done this work in other places, I do think that Jackson County is proactive in their looking for, they're not sitting there, we have people, so we have the high-tech crimes task force, so we have people who are proactively looking for ways to help children who are in danger. So I think that that's part of it, is if you're not looking for it or you don't have the resources to address it, your statistics may not be as high. And I also think when you have families that are stressed, that stress comes out in in a lot of different ways, and some of that might be substance abuse, which leads to really poor decision making. Some of that might be doing discipline in anger and leaving, taking it too far and leaving marks on children. Really, probably the highest of the abuse or maltreatment, and this would be true for national statistics as well, is really neglect. So the omission of taking care of children that leads to an impact on the child. So again, not really poverty. We're not saying that poverty is abuse, but when you have the resources and your children are put in unsafe spaces. Yes?
What other narcotics besides fentanyl does the hair strand testing test for?
I am not the medical professional. What I will tell you is I believe there is a panel of 13 18 substances. So it does THC, like I said, methamphetamines, fentanyl, amphetamines, cocaine, heroin. And those are the ones that I've seen that have come back. Those are the things that pop out at me as being positive for. But if you had, if you wanted more specific information about that, I have two really great medical providers that could help answer those questions, or probably could do a whole presentation on that.
Thank you. I have just a comment first and then a question. My first comment is, I have a hard time getting a hair strand from me as well. I'm descendants.
We would.
My next comment is I just want you to know I have a cousin who worked for you guys for quite a while.
Chris.
Yeah, and she was a lieutenant in the sheriff's office in one county. She was a trial court administrator. She worked for the Department of Human Services. And she consistently tells me this was her favorite job ever.
Yeah.
Like she thinks it's a very amazing place to work. So I just want to tell you that. I'm sure
Thank
you
you.
probably hear that often.
I stay in contact occasionally with Chris.
Yeah.
Mostly because I want to hear those comments from her.
Well, I know she was recruiting for you when you guys were hiring back in March, I think.
Yeah. She was there when I started, so she helped get me acclimated to this community.
Yeah. She moved here to live with me to work for you.
Yeah.
And then I just want to ask you something. I think it was back in 2004 that you last upgraded the facilities and around them. And I had just started with the county. It was a big grand opening. How adequate are your facilities now? Are they still adequate?
It's just so interesting that you asked me. We are exploring expanding our campus and actually have, we've not made that public. We built
This is a public meeting. So
Yes. We have, no, I recognize that. We are in the process of buying another building in the same area of where we are. It came up as an opportunity, so we're doing this backwards. We're going to go into some strategic planning. I feel like we have spaces to grow. We need more therapists because I would like to add a therapist on staff to specifically work with the parents so that we can keep children from coming back and being put in the same positions. We need more advocates and forensic interviewers, but we have no space. We absolutely are out of space to be able to add any of that. So we will be doing a formal announcement and a capital campaign and all the things that go with expanding. We wanted to stay where we are. We like our space. We like the historic building. We like our Mistletoe. Well, now I guess it's on 10th Street. It used to be on Mistletoe, and our spaces, and have invested heavily. We did have to do some major maintenance. So I've been there 9 years, and we've been trying to plan. And I think before that we've been in that building, that space since sometime in the 90s. And what I would say is I had to do some lead abatement. I had to do some roofing repairs and siding. Well, I didn't actually do it. I had to find somebody, which was a task in and of itself. So yes, we are growing and expanding. And I think, the numbers aren't showing in the number of individual children that we're serving, but we are really wrapping around them and trying to provide as much as we can to mitigate those ACEs scores. Yes.
I'm curious about language capacity and how you manage with non-English or hearing impaired.
We have one of very few bilingual forensic interviewers in the state. It was we at one point had two. One of them left us to go to Texas. I tried to challenge her that Texas probably had enough bilingual forensic interviewers, that we needed her here. So we do that, and we have a contract with Linguava, and they are able to provide on-site, over the phone, telehealth.
I know you're primarily focused on the victim children, but I'm wondering if the essential inability to kind of hold some of these parent abusers accountable, like the lack of jail space, if you guys see an effect from that.
You know, we were, yes, that's what I would say is yes. I think, but I think that I'm probably not the person to speak to that. There would be people on our MDT that could speak a lot better to that than I can. What I can say is it's really hard to provide services and have parents invested in an engagement in services to do better if there are not meaningful ways to encourage them to do that. So
I'm just wondering, when it comes to a death that occurred, like Jennifer's referring to, what are the, as far as state of mind, mens rea type things, what do you prove a gross negligence standard? Because it doesn't seem like there's really a lot of question here, who is at fault, but if it's not being pursued, there must be some barriers that are pretty difficult. Is it ownership of the drugs or the...
A case like that wouldn't have came to them.
No, I was just, again, curious.
Well,
because Jennifer brought this one.
Yeah, and it could. Our medical providers, there was a child that was, that our pediatric team did some evidence collection on that was a fatality. So we could be involved in that. What I would say is, I feel like our team would have taken that and done something with that if there was something that could be done. That's what I would say. Is I think that there are different allocations of resources in different counties, and I don't work in Josephine County, so I can't really make a determination or an opinion about that. But I feel like what I see every day is that the people are in this room and the people that aren't in this room really do put a priority on the safety of children. I feel like I'm out of time.
No, you're good.
Okay. Any other questions or comments? I would invite any of you to come and have a tour if you haven't had a tour and you would like to have a tour. I am extremely proud of what we've been able to put together and sustain, and we were able to sustain it through COVID. We never closed. We were always seeing children, regardless of what else was going on in the community. We stood tall along with all of our counterparts who were also having to do that, so law enforcement and ODHS as well. And it's just really incredible. And Mark Huddleston would tell you that he's extremely proud. If you know Mark, he's still involved. He's our not oldest, I shouldn't say that. Our longest standing board member. He's been there since the beginning. And it has really flourished into something that is a model across the country. Thank you for letting me come and talk about our services.
Yes, thank you. So next we're going to have a presentation from CASA, the Children's Advocacy.
Hi there, I'm Christina Patron. I'm the program manager with CASA of Jackson County. How many of you know about CASA? I know, well, most of you do. Okay, so we're court-appointed special advocates for children. The toughest volunteer job you'll ever love, and it's true, it's probably one of the most impactful volunteer jobs, I believe, in the county. Who are CASAs? CASAs began in 1977 by a judge who was tired of just hearing about how the parents were doing, and he needed to know how the child was doing in child welfare cases. So he put together a group of friends and volunteers and trained them to be advocates in the court, trained them basically to be a voice for the child in the court system. And now we've got, well, we started here in Jackson County in 1990, and now we have 955 CASA programs throughout the country. We are, as I said, the voices for abused and neglected children in child welfare. And CASAs are the experts experts really on the child in case. And I'll explain how they're the experts. Our CASAs are anyone who's 21, I can't say anyone, they go through the screening process, but anyone who's 21 who lives in Jackson County. We welcome all backgrounds. It doesn't matter what you do, what your education is. You just have to be 21, go through some of our interviews, and pass some background checks. We really look also for CASAs who can help with our bicultural and bilingual families too. For example, this is Casa Sandra. She's fantastic. She says that being somebody who is from the same culture and speaks the same language really helps a family through this process. CASA appointments. So to be a CASA, you have to go through our training, which is about 30 hours of training. It's a hybrid right now, Zoom and in person. Anyone can request a CASA. So if you know a child who is in the child welfare system and who really needs a CASA, just call our office and we can try and find a CASA for that child. We try and match the strengths of our CASAs to the specifics of a case. So if we have a nurse who's a CASA and we have a medically fragile child, we're going to try and match her strengths to a case that we have. CASAs can carry anywhere between 1 and 3 cases. So what do CASAs do? So as I said, we're the experts on the child. The judge, when we swear in CASAs to be an advocate, they then become a legal party to the case. The judge always tells our new graduates that the CASA report is the first report he reads because they are aware of how much knowledge this CASA has on the child versus DHS, is overwhelmed. Caseworkers are overwhelmed. They have up to 30 cases, but our CASAs usually have about 1 or 2 cases. They're required to visit the child once a month in their home, so eyes on the child. They meet with child welfare caseworkers, they meet with child attorneys, parents' attorneys. They go to their schools, they find out what they're lacking in school, what services they need. Even if they're attending school, sometimes it's the first time these kids are going to see a dentist or get medical care, and it's because that CASA is pushing for these services that the kid gets it, and also with DHS. We are privy to a lot of confidential information. We get to see their medical records. We get to really dive into what this child needs so that we can advocate for the best interests of this child in court. It is one of the only opportunities people have to advocate for a child in court without a law degree. So why CASA? We've got 750 kids right here in Jackson County that become involved in child welfare. That's just our county. The main reason, and I'll say 99% of the time, is substance abuse. And with substance abuse comes neglect, and that's child abuse. These parents, they're deep in their addictions, they love their children, they can't get out of the addiction, and that's pretty much 99% of what we see. We also see mental health being a reason, domestic violence being another reason, and physical or sexual abuse. Now, as I said, child welfare, DHS is overwhelmed. They can't possibly monitor every need of these children. and that's where a CASA comes in. That CASA is that consistent, stable person in this child's life. This child may bounce from foster home to foster home, may get different child caseworkers, but that one CASA keeps showing up in their lives, and that is an amazing impact on the child. You should see a child, sorry, go ahead, Justin.
Since Measure 110 was voted in, have you seen that number increase,
Have we?
or do you know?
So what we're facing right now is child welfare is working very hard not to open cases and not to find child abuse and neglect at the hotline, at the point of the hotline. I can talk more about this, but we probably don't have time. So we are seeing our numbers drop, as Tammy pointed out in her program as well. And it's probably due to the same reason we are on the high-intensity drug trafficking corridor here in Jackson County, which does not help with the availability of substances here. So our numbers are dropping. Just pre-pandemic, we had about 950 kids annually under the care of child welfare. Now we're down to 600 and something. So, and just cases are just not being open. They are bringing services into the home to try to sustain the family unit, and that's great when that works, but it oftentimes, sadly, it doesn't work. Parents seem to respond best when there is maybe a court order in place, and that's what I think.
That there's some consequences?
There's some consequences, yeah.
Thank you.
So studies show that children with a CASA are 98% less likely to experience re-abuse. We're actually at less than 1%. If a CASA is on a child's case, they are less than 1% likely to experience re-abuse. 50% less likely to languish in foster care. That CASA is that push, they're that whistle, they're that person who is speaking to the judge and the judge is listening. The children achieve greater academic success, and why is that? Is because we are in their schools, we're finding out why they're not attending school, we're finding out why they're failing their classes, we're finding out what needs do they need, or what assessments do they need. They receive more needed services more often, and they experience less placement disruptions. So basically they experience less bouncing from foster home to foster home when there's a CASA on the case. This is Joe. He's just a phenomenal person. He is one of our CASAs. He's had many cases. He's also a peer mentor for our CASAs. I don't know how long ago this was when he came into Jennifer's office and told her a story recently of a child who is now a young adult and reached out to him. The case has been closed for a long time, and reached out to him and basically told him if it weren't for him who showed up on her case, she would not be here today. She was ready to take her life. And then he just kept showing up in her life. So we receive information, we receive very confidential information that attorneys receive, that the judges receive, but we necessarily, of course, can't share that information with anybody. You know, we're always looking for CASAs. So spread the word. If you know anybody that wants to get involved or give back or is interested in helping these kiddos, let us know. Have them call the CASA office. This is our guiding principle. We really try and train our CASAs that this is not about what you think is ideal for the kid. We train our CASAs to work toward what is in the best interest of the child. So when a child comes into care, the first primary plan is let's reunite these kids with their family if safe. So DHS and CASA, we're going to work hard to try and reunite this child if the parents are engaged and doing what they need to do, because study after study shows that children do better in the long run when they can stay with one parent or stay within their family. So that's the primary plan. We've always got a second plan in place. If that's not looking good, reunification with the child, we've got plan B. and that's probably community resource, so that's foster care. So we prioritize, as I said, returning a child to a parent if it's safe, but that's not always the outcome. CASAs have a tremendous amount of support. We've got case supervisors. Every CASA has a case supervisor. Some CASAs have peer mentors, experienced CASAs that kind of take them under their wing. And we provide, the case supervisors provide support for them on a daily basis. So they always have coaching, mentoring, people to come to, people to ask their questions to, ongoing trainings to, we offer once a month. A case for a CASA, this is average, usually requires about 8 to 10 hours a month, sometimes less, sometimes more, depending on the difficulty of the case. And we always tell our CASAs you can co-CASA. You can CASA with a partner, you can CASA with your spouse, you can CASA with these people met at our training, and they are a powerhouse in the courtroom. They take on some of our most difficult cases, and they've had tremendous success because of their presence on the case. We also have what's called a Mighty program, so we've got teens, and teens need to be CASA'd a little bit differently, so we've got a lot of folks interested in just working with teens and mentoring them, so we have a program that offers that. And we've also got at the bottom here family finding and connection. So once a child comes into child welfare, this department is just on a constant, continuous search for family to connect this child with. That could be possibly placing this child with that family or just connecting a child with family. So that's always going on in the background. And they work for us and partner with DHS. Our budget, 90% of our budget comes from grants and fundraising and major gifts. We receive VOCA, Victims of Crime Act funds, and we have 4 annual fundraisers, which I'll invite you to take a part of. One's coming up in May, but this is where the majority of our budget comes from.
And VOCA is leaving.
And VOCA is leaving. All right, so if you know of anybody that wants to become a CASA, they can come to our orientation, they can contact our office, and we'll walk them through the steps. And that's it. Randy.
First, I just want to make a comment. I'm really proud of the work that both CASA and CAC do. I've got 3 decades of experience with both groups, and you guys do fantastic work. However, I want to editorialize for a second. You have demonstrated some statistics that are very concerning to me. So, we basically legalized hardcore drugs in our state. Addiction rates are going up, overdose rates are going up, but children victims are not going up. That's a problem to me. And I think as a group, this is why we're here. We need to try to figure out how we solve that for our community, because we're not going to treat those folks that we're actually getting out of that cycle. They're going to be back in the cycle because we're basically saying it's okay to expose your children to this, to narcotics, and it's going to create a future that I fear that the positive future that we were seeing coming down the pipeline might not happen. So I'm just editorializing there for a second because I really appreciate everything that you guys do, but your numbers dropping like that when we have a counterbalance that they should actually be going up concerns me.
I was going to say that's a statewide problem. It's happening. We have 22 CASA programs in the state representing all the counties. And I'm on the board for our statewide organization, and we're hearing this in every single program. It is a statewide issue. If a parent is doing substances, that is not a reason to remove a child. It's not a crime. It's not a reason. Where in the past it was. So that's a lot of what you're seeing. And what we're seeing is, even though we're seeing fewer cases, and Tammy can probably testify to this too, is the cases we're seeing are really egregious. They're much worse because they've already tried 6 months of in-home services, and now what we end up with is pretty damaged children in the cases where it doesn't work.
well, just correct me if I'm wrong too, just the mere numbers of people going through the court system, we're not seeing that where you guys even have an opportunity to get involved.
Right, correct. And when they've written a lot of articles about there being a shortage of public defenders and the contract not aligning with the needs of the work, and they talk about the criminals who are unrepresented and being released early from incarceration. These are children too who are not getting the attention they need from the public defenders as well. And they're victims, they're not criminals.
I guess my concern is that these numbers will be spun in a direction like, hey, look, the numbers are down, this is good. Because if you just looked at it on a piece of paper, that's what you would see. When going back to Randy's point, that is completely inaccurate.
The statewide child welfare, there's been articles, more than 2 that I know of, published in the Oregonian that say that they're solving the problem, and this is amazing. We also know that there's across the United States 16 million children now not in school. And just started at the beginning of the pandemic, and it's only increased. And teachers are our #1 mandatory reporter.
Yeah, I was thinking the same thing when the CAC numbers were going down, well, it's because kids aren't in school, but then now that we're hearing all about the exposures that they're having, I think that's, Measure 110 is part of the problem.
Absolutely.
And way back when dinosaurs roamed the earth and I was in college taking criminology classes, one of the things that we were taught was the fastest way to lower your crime rates, have less enforcement and less investigation and less cops on the street. Well, we have the less enforcement, less investigation issue because of Measure 110.
Yeah.
It'd be interesting to find out if there's a way to measure, I mean, I don't know how you would do it, but that's the problem with statistics, is that you can get them to kind of say what you want to say, and then they get used in the wrong direction. It'd be interesting if there was a way to, I just don't know how you do it.
I think there's
people are slipping through the cracks.
I think there's a pretty good link between the number of people, adults, who used to be convicted of felonies for PCS. So like a 30% drop in the supervised population case-wise, or statewide, is that about right? So if you see a 30% drop, I mean, that's a direct correlation, obviously. And then both of the same things are happening at the same time.
Statistics are funny, and I'm told personal level. I lost my sister last year to a fentanyl overdose, 4 kids. She had 2 sets of kids, 2 I didn't know about. The older 2, when they were probably 2 years old, the state contacted me, asked if I would take them in, and I said, I'll adopt them if you'll let me have them. Like, I can. That connection to this, there's these statistics that it's always better. I fought that, and I fought that for 15 years. I fought it until eventually the kids tested positive for drugs, she dies, and the kids are worked at the state. It was the most, I could talk about this so personally for hours, but the idea that the parents is always best and fundamentally against. And sometimes you gotta look at, when you have a 15-year view of what it's gonna be like, it's not gonna get better. And so having some teeth on it from certainly a judicial or some law to say, we could have fixed this, she'd probably be alive. We could have done so many things different over those years. And those kids have turned out terrible, if I'm honest. Like, I think the oldest is incarcerated, she has one that's doing quite well, and then the 2 little, until I got a phone call in spring break last year with my children that she passed, I didn't know they existed. So, I don't know, it's just, it's tough. I don't have an answer, but I always felt, when I was trying to advocate for her children, that I was fighting against the court system. I would say, it's best that she's involved, and I'd say it's not. How many times are we gonna do this? It's not best. And, just a personal.
Travis, you are not the only person that feels that way, and caseworkers fight with that too. So there's so many parental rights that they have that we're up against, that, I mean, we're saying the same thing. It's not
hard to have a child and to be given all these rights because those rights are.
And just to say this, I mean, it has to be defensible. Public defender's office is right here. If it's not defensible, it's going to be overturned in the Court of Appeals. Nobody ever wants that. because of the expense and how it looks. And so, you know, sometimes it's the path of least resistance. But we also do have, just so you know, we do have some amazing reunifications where parents really do step up and make the changes they need, and it's a wonderful outcome. It's just like anything that's made a policy or legislated, it's one blanket for all. And that is not what needs to happen in these children's lives.
That's in the cases that get referred to you, though. I think the point here is all these kids are falling through the cracks now.
Yeah.
Because all of these adults aren't coming into the system, no one's reporting it, it's not making it to you, and the kids just suffer and get lost. And so those aren't amazing reunifications, those are kids living in a horrid environment because their parents can sit there and use drugs right in front of their face.
And it's legal.
Right.
And that's the concern, and then that's gonna get spun as a win, and it's not.
Very astute of you to notice that. They've heard me at the office complaining about that a little bit.
Yes.
In a perfect world, would DHS have enough caseworkers that we wouldn't need CASAs? Or is it totally different?
It's different, I'm sorry to interrupt.
No.
But so our focus is a child's best interest. That is not the mandate of child welfare. Nobody actually has that mandate except the CASA, believe it or not. Child welfare, because it's a government agency, has many more layers of expectations put on top of them. And that's not to say that caseworkers don't care, they do care. They just have so much else to do.
Quite honestly, there's a shortage for caseworkers right now. Our local office, I don't have checked lately, but at one point they were consistently about half.
They just told me that they're about to be fully staffed.
Okay.
So that's.
Well, let's see how
that's
long.
good.
Sorry.
Yeah,
This is my third time.
Yeah, I don't think there's any agency in this room that doesn't have a shortage of staff, honestly.
But the one powerful thing we have for our agency is CASA stands alone. So CASA can be completely against what DHS is advocating, and the judge will listen to the CASA and not return those kids. So that's the one hope we often have, is that powerful voice of the CASA, who can really see and is not associated with the state. Any other questions? I want to thank you for all you do in our community and listening to me.
Thank you very much. We very much appreciate it. Thank you. So I think that concludes our agenda for the day, and I think that we're adjourned unless anyone has any questions. Thank you very much.